If you clicked on this video, there is a very good chance you are sitting there right now with a toothache and you just want something, anything, to make the pain stop. So let's get right into it, because you do not need an introduction right now. You need relief. And that is exactly what this video is going to give you. We are going through 10 home remedies that can actually help with toothache pain. And number 7 is something almost everyone already has sitting in their kitchen cabinet right now. So stay through the whole list, because that one surprises people every single time. But before we get into the remedies, there is one thing that needs to be said clearly right at the start. These home remedies are not a replacement for seeing a dentist. They are not a cure. They are not a long-term solution. A toothache does not go away on its own. Even if the pain fades for a few days, that does not mean the problem is resolved. It usually means the problem is still there, and possibly getting worse beneath the surface. If you have an active cavity, an infection, an abscess, or a cracked tooth, you need a professional diagnosis and professional treatment. The home remedies in this video are here to help you manage the pain and get through the hours or days until you can get into a dental office. Please keep that in mind as we go through everything. Call your dentist as soon as you can. And if you are experiencing throbbing pain, pain that keeps you awake at night, swelling in your face or jaw, or fever alongside your toothache, do not wait. Go get seen right away, because those are signs of an infection that can become serious. Now, let's talk about the remedies. The very first thing you want to do when a toothache hits, before anything else, before you reach for any home remedy at all, is manage the inflammation. This is the foundation of toothache pain management, and if you skip this step, the other remedies will not work as well as they should. Inflammation of the gum tissue, or the nerve inside the tooth, is almost always a major contributor to the pain you are feeling right now. Your body is sending blood and immune cells to the area, and that creates pressure, and that pressure is a huge part of what hurts. The best thing you can reach for first is ibuprofen. You might know it as Advil or Motrin. The reason ibuprofen works better for toothache pain than acetaminophen, which is Tylenol, is that ibuprofen is an anti-inflammatory medication. It does not just block pain signals. It actually reduces the inflammation that is causing the pain. Acetaminophen handles the pain signal itself, but does nothing about the underlying swelling. For dental pain, that anti-inflammatory action makes a meaningful difference in how much relief you get. Always take ibuprofen with food and follow the dosing directions on the package. Do not take more than directed. And if you have a medical reason you cannot take ibuprofen, then acetaminophen is still better than nothing. Talk to your pharmacist or doctor if you are unsure which is appropriate for your situation. Alongside the ibuprofen, grab a cold compress. A bag of ice wrapped in a thin cloth or a cold pack from your freezer applied to the outside of your cheek on the side where the toothache is located is going to help bring down that swelling from the outside. Apply it for about 20 minutes at a time, then give yourself a 20-minute break. Then apply it again. Do not put ice directly on your skin without a cloth in between, because you can cause skin irritation or frostbite with prolonged direct ice contact. The combination of ibuprofen working internally and a cold compress working from the outside is genuinely one of the most effective approaches you have available to you at home for acute toothache pain management. Starting there before anything else gives you a much better baseline to work from. Now, before you do anything else, take a good look inside your mouth. Get a flashlight if you need to. Look around the tooth that is hurting and specifically look at the gum line around it. Sometimes what feels like a serious toothache is actually being caused or significantly worsened by a piece of food or debris that has gotten lodged between the tooth and the gum. A popcorn hull is one of the most common culprits. A small piece of meat fibre, a seed, a tiny fragment of something crunchy. These things get packed into that space between the tooth and the gum, and they create pressure and irritation that can feel exactly like a toothache. If you can see something in there, try rinsing vigorously with warm water first. If that does not dislodge it, take a piece of floss and tie a small knot in it, and then gently drag that knotted section through the space between the tooth and the gum. The knot adds a little extra sweeping action that can help pull debris out. This takes about 2 minutes, and if it is the cause of your pain, you will feel relief almost immediately. Remedy number 1 on the actual list is a saltwater rinse. This is probably the most widely recommended home remedy for toothache pain, and there is a very good reason for that. It works. Salt water is a natural antiseptic. When you rinse with it, you are cleaning the area around the painful tooth, reducing bacterial presence, and also drawing some of the fluid out of inflamed gum tissue through osmosis. That fluid reduction reduces the pressure in the tissue, which reduces the pain. The ratio is simple. Take a full glass of warm water and dissolve 1 teaspoon of table salt into it completely. Then rinse for several seconds, spit, and take another sip and rinse again. Work your way through the entire glass like that, rinsing in sections and spitting each time. You can repeat this as many times as you need to throughout the day. There is no limit on how often you can use a saltwater rinse. Warm water feels better than cold against an inflamed tooth, so stick with warm, not hot, and not cold. Hot can aggravate sensitivity, and cold can trigger a sharp pain response if your tooth nerve is already irritated. Remedy number 2 is a hydrogen peroxide rinse. Hydrogen peroxide has antimicrobial properties, and it can help reduce bacteria around a painful tooth while also helping with any minor gum inflammation in the area. The important thing here is that you do not use hydrogen peroxide straight from the bottle. You need to dilute it. Mix it 50-50 with water, so half hydrogen peroxide and half water in a small cup. Swish that around your mouth for about 30 seconds and then spit it out completely. After you spit, go back and rinse your mouth thoroughly with plain fresh water to remove any residual peroxide. Do not swallow the solution, and do not make this a daily habit because hydrogen peroxide used regularly does disrupt the natural bacterial balance inside your mouth, killing beneficial bacteria alongside the harmful ones. But as an occasional targeted use when you are dealing with acute tooth pain, it is a legitimate and effective option. Remedy number 3 is head elevation. This one sounds almost too simple, but it genuinely helps, and it is especially important at night when toothache pain tends to get significantly worse. When you lie flat, blood pressure in your head increases. More blood flow to the area around an inflamed tooth means more pressure and more pain. If you have ever noticed that your toothache seems unbearable the moment you try to go to sleep, but is slightly more manageable when you are sitting up or standing, this is exactly why. When you go to sleep tonight, grab an extra pillow or two and prop yourself up so your head is elevated above the level of your heart. If you have a recliner, sleeping in it at a slight recline is actually ideal for toothache nights. Even a modest elevation makes a real difference in how much that nighttime throbbing intensifies. Pair this with your ibuprofen taken about 30 minutes before you try to sleep, and you give yourself a much better chance of actually getting some rest. Remedy number 4 is a peppermint tea bag. This one tends to get surprised reactions when people hear it, but it is a genuinely useful trick. Tea bags have mild numbing and soothing properties that can take the edge off localized gum pain, and peppermint adds a slight natural numbing effect from the menthol it contains. The technique is simple. Soak a peppermint tea bag in warm water for just a few seconds, not a full brewing, just a brief soak, and then squeeze out most of the excess water and place the warm, damp tea bag directly against the area of your mouth that hurts. Hold it there for several minutes. The warmth combined with the compounds in the tea creates a soothing effect on the irritated tissue. You can also try this with the tea bag slightly chilled if you find that cold provides more relief than warmth for your particular pain. Some people find warm more soothing, others find a cold tea bag more effective. Try both and see which your mouth responds to better. Remedy number 5 is clove oil. This is one of the oldest known dental pain remedies in existence, and it works for a very specific chemical reason. Clove oil contains a compound called eugenol, which is a natural anesthetic and antiseptic. It actually numbs the tissue it comes into contact with. Professional dentists have used eugenol-containing compounds in dental procedures for generations. When you use clove oil at home, you're accessing that same numbing mechanism in a diluted form. You can apply it a couple of ways. If you have liquid clove oil, soak a small cotton ball with it and hold that cotton ball directly against the sore tooth and gum for several minutes. Alternatively, you can dab a very small amount directly onto the gum tissue around the painful tooth using a cotton swab. Use a minimal amount. Clove oil is potent, and applying too much can actually irritate the soft tissue of your mouth. A little goes a long way. You should feel a warming or slightly tingling sensation, followed by a numbing effect within a few minutes. If you cannot find clove oil at a pharmacy or health food store, you can sometimes find whole cloves in the spice section of your grocery store, and simply chewing gently on a whole clove near the painful area releases some eugenol and can provide mild relief. Remedy number 6 is garlic. And before you scroll past this one, hear it out. Garlic has been used as a natural antimicrobial remedy for an extraordinarily long time, and the reason it keeps showing up in these conversations is that the science behind it is real. Garlic contains a compound called allicin, which is released when garlic is crushed or chewed, and allicin has documented antibacterial properties. For a toothache caused or worsened by bacterial activity around the tooth or gum, applying garlic to the area can help reduce that bacterial presence. The method is straightforward. Take a fresh clove of garlic and crush it or mince it to release the allicin. Then apply the crushed garlic directly against the sore gum and tooth area. Hold it there for a few minutes. If direct contact is too uncomfortable because the area is already very sensitive, you can try placing a small piece of crushed garlic against the tooth and holding it in place with your cheek. Yes, your breath is going to be something memorable afterward. But when you are dealing with tooth pain that is keeping you up at night, breath is the very last thing on your mind. This is a short-term pain management tool, and it is one that works for many people. Remedy number 7, here it is. The one that is already in your kitchen right now. Vanilla extract. Real vanilla extract, not imitation vanilla flavouring, the real kind that you use for baking. Real vanilla extract contains a small percentage of alcohol, usually somewhere around 35%, and the alcohol acts as a mild numbing agent on contact with soft tissue. It also contains antioxidant properties that may contribute to a soothing effect on inflamed gum tissue. The application method is very simple. Put a few drops of vanilla extract onto a cotton swab or a cotton ball and apply it directly to the painful tooth and the gum around it. Hold it in place for a minute or two. Do not rinse your mouth with vanilla extract or try to use it as a mouthwash. You are using a very small amount in a targeted way on the specific area that hurts. This is something that is sitting in the back of most people's kitchen cabinets right now, completely forgotten, and it genuinely provides temporary numbing relief. It is not going to eliminate severe toothache pain on its own, but as part of your overall management approach, it is absolutely worth reaching for, especially when it is late at night and you cannot get to a pharmacy. Remedy number 8 is a cold compress, and yes, this was mentioned earlier in the context of managing inflammation, but it deserves its own spot on this list because of how versatile and effective it is, and because many people underestimate how consistently they should be using it throughout the day. The cold does two things simultaneously. It numbs the nerve endings in the tissue around the painful tooth through the cold temperature itself, providing direct pain relief. And it constricts blood vessels in the area, which reduces blood flow and reduces inflammation and swelling. Both of these mechanisms work in your favour when you have a toothache. Wrap ice in a thin cloth or use a commercial cold pack. Apply to the outside of your cheek on the painful side for 20 minutes. Break for 20 minutes. Repeat. Keep doing this cycle throughout the day whenever the pain is at its worst. If you run out of ice, a bag of frozen vegetables from your freezer works just as well. Remedy number 9 is keeping the area clean with targeted rinsing and gentle flossing. This one sounds obvious, but it is genuinely underused. When a tooth hurts, the instinct is to avoid touching that area entirely, to eat on the other side, to skip flossing near it, to be very gentle when brushing there. And while you should absolutely avoid biting down hard on a painful tooth and should chew on the other side, completely avoiding cleaning the area around a painful tooth can actually make things worse. Bacteria accumulating around an already inflamed tooth adds bacterial irritation on top of whatever structural issue is causing the pain. Keeping the area gently clean helps reduce that bacterial contribution to the pain. Use warm water for rinsing because cold water can trigger sensitivity and make the pain sharper. Rinse gently rather than swishing aggressively. Floss carefully and slowly around the painful tooth rather than snapping the floss down hard into the gum. And brush the area with very light pressure. Think of it as maintenance cleaning rather than anything vigorous. Keeping things clean in a gentle and targeted way helps your body manage the situation better while you wait to see your dentist. Remedy number 10 is something that catches people off guard because it does not involve putting anything in your mouth at all. It is pressure point application. There is a pressure point located in the webbing between your thumb and index finger, the fleshy V-shaped area between those two fingers. Applying firm pressure to this spot has been used in acupressure traditions for a very long time as a technique for reducing various types of head and facial pain. The evidence behind it is not as robust as the evidence behind the other remedies on this list, but many people report that it provides some degree of relief during acute pain episodes, and given that it costs absolutely nothing and has no side effects, it is worth trying, especially when you are sitting somewhere without access to any other remedies. Use the thumb and index finger of your opposite hand to pinch that webbing firmly and hold the pressure for a few minutes. You are looking for a moderate pressure that is slightly uncomfortable but not painful. Some people feel a mild reduction in the intensity of their toothache within a few minutes of applying this pressure. It is not going to replace the other remedies on this list, but as a supplementary approach, it adds another tool to what you're working with. Now let's talk about what to watch for, because some toothache symptoms are signals that you need to get to a dentist immediately and not wait for a convenient appointment time. If your toothache is accompanied by swelling in your face or jaw, that swelling needs to be evaluated right away. If you have a fever alongside your tooth pain, that is a sign of infection that may be spreading and that requires prompt attention. If the pain is a severe, constant throbbing that is not responding at all to ibuprofen and the home remedies, that level of pain usually indicates something significant happening that needs professional diagnosis. If you notice a small pimple-like bump on your gum near the painful tooth, that is called a dental abscess, and it is an active infection that needs treatment. These are not situations where home remedies are sufficient. These are situations where you call a dentist today, go to an urgent care dental clinic, or if the swelling is significant enough or you have a fever, go to an emergency room. For situations that are painful but not at that emergency level, the combination of ibuprofen, cold compress, saltwater rinses, and whichever of these remedies provide you the most targeted relief for your specific situation should help you manage through until your dental appointment. Every toothache is different. The location of the pain, the type of pain, whether it is triggered by temperature or pressure or spontaneous, all of these things point toward different underlying causes. A dentist needs to examine you, possibly take an X-ray, and determine what is actually happening. These remedies address the symptom of pain. They do not address the cause. The cause needs professional attention. One more thing before wrapping up. Try to eat soft foods and chew only on the side of your mouth away from the painful tooth while you are waiting for your appointment. Avoid very hot or very cold foods and drinks because temperature sensitivity is common when a tooth is inflamed or infected and you do not want to trigger additional pain unnecessarily. Avoid biting down hard on the painful side. Stick to things that require minimal chewing. Soup, yogurt, soft bread, mashed foods. Things that let your painful tooth rest as much as possible until you can get professional treatment. If this video helped you, leave a comment below telling which remedy worked best for your situation. Every single comment gets read, and your experience might help someone else who is going through the same thing right now. Share this video with anyone you know who deals with dental pain, because this kind of information is genuinely useful in those moments when pain hits unexpectedly and a dental office is not immediately accessible. And make sure notifications are turned on, because there is more content coming that covers dental health topics in the same straightforward way this video did. Go get some relief. And then call your dentist. Disclaimer: this video is for educational and informational purposes only. The content presented here reflects personal opinions and information gathered from publicly available sources, including YouTube, Google, news articles, and general health and wellness content found online. Nothing in this video should be considered professional, medical, or dental advice, diagnosis, or treatment of any kind. Always consult a licensed dentist or qualified healthcare professional before making decisions about your dental or medical health, especially if you have existing conditions or are experiencing severe symptoms. The creator of this content is not a medical professional, dental professional, or licensed healthcare provider of any kind. Individual experiences and results may vary. Do not delay seeking professional dental or medical care based on anything presented in this video.